AIDS, acquired immune deficiency syndrome, is the final stage of HIV disease, which causes severe damage to the immune system. AIDS symptoms. AIDS begins with HIV infection. People who are infected with HIV may have no symptoms for 10 years or longer, but they can still transmit the infection to others during this symptom-free period. If the infection is not detected and treated, the immune system gradually weakens and AIDS develops. Acute HIV infection progresses over time, usually a few weeks to months, to asymptomatic HIV infection, no symptoms, and then to early symptomatic HIV infection. Later, it progresses to AIDS, advanced HIV infection with CD4 T cell count below 200 cells mm3. Almost all people infected with HIV, if they are not treated, will develop AIDS. There is a small group of patients who develop AIDS very slowly, or never at all. These patients are called non-progressors, and many seem to have a genetic difference that prevents the virus from significantly damaging their immune system. The symptoms of AIDS are mainly the result of infections that do not normally develop in people with a healthy immune system. These are called opportunistic infections. People with AIDS have their immune system damaged by HIV and are very susceptible to these opportunistic infections. Common symptoms are chills, fever, sweats, particularly at night, swollen lymph glands, weakness, weight loss. Note: at first, infection with HIV may produce no symptoms. Some people, however, do experience flu-like symptoms with fever, rash, sore throat, and swollen lymph nodes, usually 2 to 4 weeks after contracting the virus. Some people with HIV infection stay symptom-free for years, between the time when they are exposed to the virus and when they develop AIDS. AIDS treatment. There is no cure for AIDS at this time. However, a variety of treatments are available that can help keep symptoms at bay and improve the quality of life for those who have already developed symptoms. Antiretroviral therapy suppresses the replication of the HIV virus in the body. A combination of several antiretroviral drugs, called highly active antiretroviral therapy, HAART, has been very effective in reducing the number of HIV particles in the bloodstream. This is measured by the viral load, how much free virus is found in the blood. Preventing the virus from replicating can improve T cell counts and help the immune system recover from the HIV infection. HAART is not a cure for HIV, but it has been very effective for the past 12 years. People on HAART with suppressed levels of HIV can still transmit the virus to others, through sex or by sharing needles. There is good evidence that if the levels of HIV remain suppressed, and the CD4 count remains high, above 200 cells mm3, life can be significantly prolonged and improved. However, HIV may become resistant to one combination of HAART, especially in patients who do not take their medications on schedule every day. Genetic tests are now available to determine whether an HIV strain is resistant to a particular drug. This information may be useful in determining the best drug combination for each person and adjusting the drug regimen if it starts to fail. These tests should be performed anytime a treatment strategy begins to fail and before starting therapy. When HIV becomes resistant to HAART, other drug combinations must be used to try to suppress the resistant strain of HIV. There are a variety of new drugs on the market for treating drug-resistant HIV. Treatment with HAART has complications. HAART is a collection of different medications, each with its own side effects. Some common side effects are collection of fat on the back, buffalo hump, and abdomen, general sick feeling, malaise, headache, nausea, weakness. When used for a long time, these medications increase the risk of heart attack, perhaps by increasing the levels of cholesterol and glucose, sugar, in the blood. Any doctor prescribing HAART should carefully watch the patient for possible side effects. In addition, blood tests measuring CD4 counts and HIV viral load should be taken every 3 months. The goal is to get the CD4 count as close to normal as possible, and to suppress the amount of HIV virus in the blood, to a level where it cannot be detected. Other antiviral medications are being investigated. In addition, growth factors that stimulate cell growth, such as erythropoietin, epigen, pregrit, and recamin, and filgrastim, GCSF or Neupogen, were sometimes used to treat AIDS-associated anemia and low white blood cell counts. Medications are also used to prevent opportunistic infections, such as pneumocystis jirovecii pneumonia, if the CD4 count is low enough. This keeps AIDS patients healthier for longer periods of time. Opportunistic infections are treated when they happen. AIDS is a common disease, yet every individual needs unique treatment and care. We encourage people with AIDS and their families to learn as much as possible about the latest medical treatment and approaches, as well as healthy lifestyle choices. For more information about AIDS and how to treat AIDS, just click on the link at description. or visit www.mainmd.com. Thank you.